Hello, how are you? I'm Dr. Alexander Mota, physical therapist, osteopath, and author of the digital book Segredos da Coluna Sem Dor. And today I want to teach you simply the best exercise I know to improve pain and symptoms related to the sciatic nerve. Stay tuned to the video because at the end I'll give you 2 extra tips. But before starting the video, as always, don't forget to hit like if you're watching me on Facebook, or hit the thumbs up if you're watching me on YouTube. Otherwise, you'll search for other sciatic nerve, knee, shoulder, or elbow exercises on our channel, and forget to hit the like button. When you hit the like button, you help our channel, our page to grow, and you make it so that our tips, our messages reach more and more people and help us to help even more people. So don't forget, hit the like button, and let's get to the video. The sciatic nerve is well known to anyone who has a back problem or who has tightness in a muscle called the piriformis. It's very common for people with either of these 2 problems, either in the spine or in the piriformis muscle, to feel pain, a burning sensation, a shock-like feeling, numbness, or tingling. It runs from the buttocks down the back of the leg, sometimes reaching the sole of the foot, which follows the sciatic nerve's path. It starts in the lumbar spine and goes behind the buttocks, down the knee, the calf, and all the way to the sole of the foot, the bottom of the foot. And since we're going to work on the nerve, obviously you remember those neural mobilization techniques we talked about for the upper limb, for the arm, for the ulnar nerve, median nerve, and radial nerve.
And this exercise, to improve the health of the sciatic nerve, is also a neural mobilization exercise. To do this exercise, you will follow 5 steps. First, you will lie down near the wall, facing up. Ideally, you should lie on the floor or on a firmer surface. You can use an exercise mat or a yoga mat, something similar to cushion and make it more comfortable. And if you can't get down or lie on the floor, you can use a bed, but preferably a firmer, harder bed. And the second step is to support your leg, resting your heel on the wall. Your leg should be straight and relaxed. And you can use something to make yourself more comfortable. And to help with the exercise, you can use a ball, a cushion, or a pillow. In the demonstration, I'll do it without those so you can see the movement better. In the third step, you'll pull your toes toward you. You will bend your ankle as if you were pulling your toes toward you. In this third step, you will adjust your distance from the wall, the ideal distance for you. When you pull your toes toward you, you should feel a stretch behind your leg, along the whole back of your leg. You shouldn't feel any pain. So, if you pull your toes toward you and don't feel the stretch, you're too far, move closer to the wall and retest, pull your toes toward you again. If pulling your toes toward you causes pain, it's because you're too close to the wall. So move a little farther away and test again. Remember, you should feel a stretch in the back of your leg, not pain. Remember, the 4th step is to keep your head higher than your body. For that, you should use a firmer cushion like this or a pillow. If the pillow is too soft, fold it in half. And the 5th step is to actually do the movement, to actually do the exercise. You're going to do a dorsiflexion and a plantar flexion. Pull your toes toward you as much as you can and stretch your foot as much as you can. Remember that this movement is rhythmic. You should do 60 repetitions. If you can't do all 60 repetitions because you feel pain, discomfort, or your foot starts tingling, break those 60 repetitions into smaller sets with fewer reps. You can do 2 sets of 30 repetitions, 3 sets of 20 repetitions, or 6 sets of 10 repetitions. The important thing is that you do this exercise every day. And it's also important that you do this exercise, that you practice this exercise with both legs alternately, not just with the leg where you feel the symptom. If you feel pain, tingling, or any more intense symptom in the sciatic nerve, I recommend that during the first 2 or 3 days, or even during the first week, you take it easy. Only use the leg that doesn't have the symptom. In other words, only the good leg. And after those 2, 3, or 5 days, working only with the leg that doesn't have symptoms, you will start working with the leg that has the symptom. Why am I asking you to do this? Because in some people, after you work on neuromobilization, there is a worsening of symptoms in the first 24, 48 hours. So if you have any more intense symptoms, pain, tingling, or a shock-like sensation, start by working only with the good leg, the leg that doesn't have these symptoms. And after a few days, start working with the leg where you have the symptoms, the leg where you have pain, tingling, or the shock-like sensation.
And once again, it's time to share. This is another way for you to help our channel grow, but mainly to make sure we can help more and more people. So show this video to everyone you know, to anyone you think might benefit from it, to your family, your friends, or anyone you know who complains about sciatic nerve pain or lower back pain. Teach them this exercise, show this video to them, and be sure that a simple tip like this can really help reduce someone's pain. Hey man, don't scare me like that. What's up? You're forgetting the tip, man. That's true. I almost forgot. There are many people who usually take medicine, do physical therapy, sometimes even undergo some specific treatment, some specialized treatment, some kind of manual therapy to relieve sciatic pain. And sometimes this pain gets better, but comes back, or sometimes it doesn't even get better. And there are some things that I've noticed over these 10 years that can contribute, even if you already have good body mechanics, even if you already have a healthy structure. For men, it's the wallet when carried in the back pocket. And for women, it's the habit of sitting with crossed legs. And why can a wallet cause sciatic pain in someone? Many men carry their wallet in their back pocket. And obviously, like almost everyone, spend a good part of the day sitting, whether working on the computer or even worse, sitting on a motorcycle. And why do I say that riding a motorcycle is worse? Because besides having the wallet pressing on the sciatic nerve, which is exactly where the piriformis muscle is, there's also the vibration, the jolting of the motorcycle when you're riding. And that's why so many people suffer for so long with sciatic pain. Because they get treatment, feel better, but keep putting their wallet in their back pocket and don't pay attention to this detail. And the wallet keeps pressing on the nerve and the pain comes back. Electric shock sensation, numbness, weakness in the leg. So simply changing from keeping your wallet in your back pocket to putting it in your front pocket already helps a lot. Another thing is to try to reduce the size of your wallet. Because let's be honest, there are a lot of men whose wallets look like a ball. So imagine the pressure that this causes on a structure, on the sciatic nerve, for example. And why can the habit of sitting with your legs crossed contribute to sciatic nerve compression or compress the sciatic nerve? Simply because when you sit with your legs crossed, you can notice this. You put more weight on one side of your butt. That is the weight of your whole body. Instead of being divided between both buttocks, between both sides of your butt, ends up being supported, concentrated on just one side. And that also compresses the sciatic nerve. Because the butt is exactly where the sciatic nerve passes through, and it's exactly where the piriformis muscle is located. That muscle, when contracted, can also compress the sciatic nerve. I'm not saying you can't cross your legs. What I'm saying is that you should choose situations where you'll be in that position for a longer time, even for professional reasons, to look more elegant, more aligned. But so that this doesn't cause you pain, discomfort, or a decrease in your quality of life, you have to work to have a healthy structure that can support those occasions, those situations where there will be more pressure. So practice this neuromobilization exercise I taught you today frequently and regularly. Exercise, preferably something that also works on flexibility, like Pilates, for example. And that way, in situations where it's necessary, you'll be able to sit cross-legged, stay better aligned, more elegant, and maintain your health and quality of life. That's it for now. Sending you a big hug and see you in the next video.
Did you like the pants I wore in the video today? These are my capoeira pants. They've been in the closet so long they're covered in dust. Terrible joke, right? Sorry.